Hello everyone, welcome back to my channel Medico's Guide. It's Dr. Ida Khan and in this video we will be discussing about ECG interpretations. Let's first have an introduction to ECG. Heart is a vital link in the oxygen transport system, pumping blood to the pulmonary and the peripheral circulation systems to supply oxygen and other nutrients required for metabolism in all the tissues. The beating heart generates rhythmic electrical impulses that cause mechanical contraction or the pumping action of the cardiac muscles. Some of the electrical current produced by these rhythmic impulses is detected by the electrodes that may be placed on the surface of the skin. Current flowing during the cardiac cycle is then recorded as the characteristic waveforms of the ECG, that is electrocardiogram. Mechanical events such as contraction and relaxation of the myocardium are inferred from the waveforms produced by the ECG. It is a recording of the electrical activity of the heart conducted through the ions in the body to the surface. So let's have a look at the normal impulse conduction. This starts from the sinoatrial node, which is a pacemaker, and then the impulses are conducted to the atrial muscles. Then from the atrial muscles to the AV node, then to the bundle of His, then it travels into the left and right bundle branches, then into the Purkinje fibers, and finally into the ventricular muscles. And this impulse conduction is recorded as waveforms on the ECG. Heart excitation related to ECG. As soon as the SA node generates impulse, atrial excitation begins, and this is followed by the formation of the P wave. Impulse is then delayed at the AV node, and here the formation of the P wave is completed. Then the impulse passes to the heart apex and the ventricular excitation begins. Now this marks the beginning of the formation of the QRS complex. Then the ventricular excitation is completed and here it ends with the formation of the complete QRS complex. Now, there is a formation of three distinct waves during the cardiac cycle, which are the PQRST. First, the P wave is caused by the atrial depolarization, that is atrial contraction. Then QRS complex is caused by the ventricular depolarization or the ventricular contraction. Then the ST segment represents the period of no electrical activity. And T wave is the result of the ventricular repolarization, that is ventricular relaxation. Now this diagram represents the PQRST on the ECG, where the P wave indicates the atrial depolarization, QRS indicates ventricular depolarization, and the T wave represents the ventricular repolarization. Recording the ECG. There are 12 leads in total. 3 are the standard leads, 3 are unipolar leads, while the 6 are chest leads or the pericardial leads. Now let's discuss them one by one. Each lead incorporates 2 electrodes, measuring the potential or the voltage difference between them. The one is the positive electrode and the other one is the neutral electrode. The positive electrodes are responsible for detecting the electrical impulse from the heart, while the neutral electrodes they complete the circuit. Now let's first discuss about the standard leads. The figure represents the direction of the lead 1, lead 2 and lead 3. Now first, the lead 1, the exploring electrode that is represented by the head of the arrow is attached to the left arm, while the neutral, which is represented by the tail of the arrow, is attached to the right arm. The lead 2, here the exploring electrode is towards the left leg and the neutral electrode to the right arm. Then lead 3, here the exploring electrode is towards the left leg and the neutral electrode towards the left arm. Unipolar leads or the augmented limb leads. Here the exploring electrode is on the right leg and the neutral electrode on all the other limbs. Here are the 3 different leads, AVL, AVR and AVF. You can remember this by R being the right arm, L being the left arm and the F being the foot, which is particularly the left foot. So the lead AVR is attached to the right arm, lead AVL is attached to the left arm, while the lead AVF is attached to the left leg. Now the chest leads or the precordial leads, here the V1, V2, V3, V4, V5, V6, these are the 6 leads. V1, V2 is used to assess the right ventricle, V3, V4 to assess the interventricular septum, and V5 and V6 assess the anterior and the lateral aspect of the heart. All limb leads, lead 1 and the lead AVL are lateral leads, while the lead 2, lead 3, and the lead AVF are inferior leads. Now let's talk about the PR interval. The PR interval represents a delay in the impulse's transmission towards the AV node, and this delay allows the time for the atria to contract to squeeze out the blood before the ventricles contract. Now let's have a look at the pacemakers of the heart. SA node, being a dominant pacemaker, has an intrinsic rate of 60 to 100 beats per minute. AV node is a backup pacemaker with an intrinsic rate of 40 to 60 beats per minute, while the ventricular cells are the backup pacemaker as well with an intrinsic rate of 20 to 45 beats per minute. The ECG paper speed is ordinarily 25 mm per second. As a result, each 1 mm that is a small horizontal box corresponds to 0.04 seconds or 40 milliseconds, with the heavier lines forming large boxes that include 5 small boxes and hence represent 0.20 second or 200 millisecond intervals. Every 3 seconds, that is 15 large boxes, is marked by a vertical line. This helps when calculating the heart rate. Now let's dive into ECG rhythm analysis. Now, there are a certain set of questions that you may need to ask yourself whenever you are taking a look or whenever you are analyzing a rhythm in the ECG strip. And these set of questions are: what is the rate and the pattern, that is regularity of the rhythm? If the RR interval, that is the distance between successive R waves, is inconsistent, is the pattern irregular? Does the P wave precede every QRS complex? This indicates appropriate atrial activity. Is there a QRS complex after every P wave? This indicates appropriate conduction of impulses from the atria to ventricle. What is a PR interval? A PR interval of greater than 0.2 seconds indicates delay in the conduction from atria to ventricles. Is the QRS complex of normal duration and morphology, that is shape? A QRS complex greater than 0.12 seconds indicate either that an impulse arose within the ventricle or was conducted abnormally through the ventricular conduction system. By answering each of these questions, the tendency to eyeball the rhythm and make a quick but inaccurate assessment is avoided. Now, rhythm analysis. Rhythm analysis incorporates the series of steps, and these steps include calculate rate, determine regularity, assess the P waves, determine PR interval, and determine the QRS duration. Now, each of the following steps will be discussed in a great detail in the next part of this video. The link will also be provided in the description below, and thanks for watching and stay tuned.